So a short note about congenital syphilis. Usually congenital syphilis results from transplacental migration of the organism to the fetus. The congenital disease can occur at any stage of maternal infection and at any gestational age, but I want you to keep 2 points in mind. One is the infection occurs more during the early phase. The second, the early means the primary syphilis, the secondary syphilis, and early latent syphilis. So during this period, the infection is more, and also during the early period, what happens is that during the early period, the bacteremia is high. It's around 100% in the blood, and what happens? The transplacental transfer is also high. So transplacental transfer is also high. So after a particular period of time, during the late latent syphilis, when the bacteremia drops down to less than 10% or 15% in the blood, the transplacental migration will also become low. So congenital syphilis, it results from the transplacental migration of the organism to the fetus. So you have to have these 2 points in mind. So next is the risk of adverse pregnancy outcome if untreated is approximately around 50%. If you don't treat the syphilis during pregnancy, it leads to adverse pregnancy outcome about 52%. So what are the adverse pregnancy outcomes? One will be stillbirth, which is 21%, neonatal death around 10%, premature birth and preterm labor, low birth weight, and infections can also be seen. So rare findings will be non-immune fetal hydrops, polyhydramniosis, and intrauterine fetal demise. So what does the CDC recommends? The CDC recommends if you find out or diagnose congenital syphilis after 20 weeks of gestation, you have to do a thorough sonological examination to find out these ultrasound pointers that points towards congenital syphilis. So what are the ultrasound pointers of congenital syphilis? The most peculiar finding will be hepatomegaly and placental thickness. You will have ascites, skin edema, polyhydramnios. Unusual findings such as small bowel dilation and hyperechogenicity. Long bones may be lagging in growth, irregularly shaped, and boved in multiple locations. So this is an ultrasound showing the hepatomegaly of the fetus, and here you can find increase in the placenta. So the size of the placenta, placentomegaly. This hepatomegaly and increase in placental size are some peculiar features pointing towards congenital toxoplasmosis. So what they say that usually in pregnancy, what we give when primary syphilis is suspected in pregnancy, when you find out the mother is having a TPHA positive, we give them a benzathine penicillin 2.4 million units IM stat. So what studies say is that a second dose should also be given 1 week later to prevent these complications, and also even after this complications is there, it's better to give 2 doses, the second dose given 1 week apart. This is what now studies say. Now this is the congenital syphilis, where you can see these skin ulcers, they are skin rash which is known as pemphigus syphiliticus, that can also be seen in the newborn. And you can see this neonatal extremity where the radiographs are seeing some moth-eaten appearance of the long bones. So some ragged edges. So moth-eaten appearance of the long bones. And you can see the placenta, which is obviously very large in size. So enlarged hydropic placenta of a syphilis infected pregnancy. So these are some of the findings which is seen in congenital syphilis.